By now, you've probably heard what Joe Biden had to say about the 9mm.
A 9mm bullet blows the lung out of the body.
For context, he was comparing a 9mm projectile to a .22 caliber bullet, while talking about what type of weapons are suitable for civilian use.
A .22 caliber bullet will lodge in the lung, and we can probably get it out, may be able to get it and save the life.
Following his statement, there was considerable backlash from firearms enthusiasts across the country, and many sought to debunk his claim with striking results. Among them were Garand Thumb and Iraq veteran 8888, whose videos we will analyze with a critical medical eye to see what information we can glean about the president's statements. We can also look forward to thought-provoking commentary from Big Daddy Unlimited, Coleon Noir, and other fellow YouTubers. As always, my goal is to educate and to evaluate the information presented with the scientific method. Let's not waste any time. Professor Garand?
We have the ballistic dummy lab right here. Now, there are different organs in it to approximate the types of materials that the bullet would travel through.
As Garand, or Garand for all my American viewers, goes on to mention, these dummies are an approximation of the human body, but they are as close as we can get to the real thing, without getting the real thing, and often used by the US military to study firearm performance and wound patterns, although the gel itself is not a direct corollary for human tissue.
The ballistics gelatin will be simulating skin, fat, and muscle tissue, and we do have this a little bit denser to get it a little bit closer to the human body.
And of course, for today's test, the dummies do have the most important organ of all.
We do have lungs. We do have ribs over those lungs. This is a pretty good test.
So let's jump into our first demonstration. Garand will fire one round of the .22 caliber ammunition into our ballistics dummy, which will act as a baseline before we progress through other ammunition types.
All right, we have the Ruger Mark IV. It's a .22 caliber pistol with a suppressor on the end. We are firing Norma .22 ammunition.
Ready when you are, Professor. And if we step in for a closer look,
the .22 entered right there. We can see the wound tract actually going through. It actually impacted the bottom of the rib and traveling to the lung. We can see the bleeding right there.
The impact with the bottom of the rib looks to have caused a fracture, slowing the bullet's momentum before it entered the lung. In regards to Biden's statement, we'll need to see the back of the dummy.
You can see it just about exited the lung and almost exited all the way out the body.
If that didn't hit the rib, that would have came out the back.
I think there is truth to that statement. If the bullet had not collided with the rib, it might have come out the back.
Doing the gut shot, we had a lot less resistance. I'm not a doctor, but I mean, I did quit med school once, so that makes me pretty damn close in New Jersey.
The important takeaway here is this. Often, when considering bullet performance inside the body, sweeping statements undermine the complexity of possible outcomes. Under the right circumstances, a .22 caliber projectile could become lodged within the lung. Under other circumstances, like a tiny difference in aim, say, a .22 caliber projectile could also pass through the body entirely.
Damn.
We'll need to keep this in mind as we continue to explore projectile performance. Now, before we continue shooting, what do we know about the 9mm round?
Not all 9mm are created equal.
People will come in and say, hey, I need some 9mm. And okay, you want Luger? Do you want Makarov?
That's Eric from Iraq veteran 8888 with his guest Ray. And the clip is from a video that goes in depth about the design and applications of different types of 9mm ammunition. When considering Biden's statements, one of the main distinctions that must be addressed is whether the ammunition in question is
full metal jacket
or hollow point.
For training, recreation, competition, and whatnot, we're going to use full metal jacket. The bullet itself has got this consistent metal jacket, usually copper.
Generally, full jacketed projectiles have less capacity to expand after contact with the target than hollow point alternatives. In self-defense situations, this can be viewed as a disadvantage, as a full metal jacket bullet may slice all the way through a target, transferring less energy to the target and resulting in a less severe wound tract that is less likely to disable the target.
Went in, there's the other two. And the one on top just continues going, went straight out the end.
And let's be honest, if you've resolved to pull the trigger in self-defense, you want ammunition that can neutralize the person threatening your life.
Because the whole purpose of having a gun for self-defense is because it's so good at stopping people who are trying to kill you.
Self-defense is not pretty. It's life or death. I'd also like to point out that a bullet that pierces all the way through a target could cause unintentional collateral damage to whatever is behind it, which could be another person in another room. Here we see tools and targets put 2 rounds of 9mm full metal jacket into ballistics gel blocks. The permanent wound channel is relatively thin and the penetration is relatively high, with both rounds exiting the back of the 24-inch block. The average human torso is approximately 14 to 18 inches thick side to side and 8 to 10 inches thick front to back.
If I was to give you a grapefruit and have you hold it in your hand and take an ice pick and stab into the grapefruit, being like, I don't want to do that because you know it's going to go straight through the grapefruit and it's going to stab you in the hand.
Unfortunately, I don't have a grapefruit and a nice pick laying around, but Iraq Veteran 8888 does have a 9mm and a watermelon.
Wow, that is kind of unimpressive, isn't it?
I mean, the round just kind of shot right through the melon.
I know, it's a watermelon. But if what Biden says is true, wouldn't you expect a little more splatter?
Wow!
Obviously, Eric is firing a much larger round. But generally speaking, a watermelon is more likely to explode than human soft tissue because of the rigidity of its shell. More similar to bone, the watermelon doesn't bend much at the point of impact, and the energy causes great stress on the fruit. Inside the human body, soft tissue doesn't provide a lot of resistance, and unless the ammunition comes into contact with the bone, it is much more likely to exit out the other side of the body. Professor Garand, what will we be using to demonstrate the 9mm full metal jacket ammunition?
Here we have a Glock 17, it's a full-size 9mm handgun, and we have 9mm. This is from Norma. It is NATO spec plus P 124 grain ammunition.
Thank you, Professor. Fire when ready. How about another one for good measure? The lung is of course punctured, and the target will be in extreme pain, but the lung has not been blown out of the body. In fact, from a distance, it is hard to tell that the body was even struck by a projectile. Garand, can you take us in for a closer look?
If you come in right here, we can take a look at those wound tracks. Entered in through the lung, we have one exit right here, and it looks like the other round, yep, we have a small exit wound right there.
Our patient will likely be suffering from a pneumothorax, which occurs when a lung has been punctured and air collects in the pleural cavity, the space between the 2 layers of the tissue lining your lung, the parietal pleura and the visceral pleura. This puts external pressure on the lungs and prevents them from expanding effectively, eventually causing the lung to collapse. You see, the lungs have no muscles. They expand due to negative pressure inside of the pleural cavity, which means holes are very problematic. James Pearson, a firefighter on Quora with many years experience, has seen many large bore needle 14 gauge, inserted between the ribs by first responders. This allows air to escape so the lung can perform its function. The patient may also require breathing assistance as they are rushed to the hospital. At the hospital, emergency treatment depends on the severity of the trauma and will require thoracostomy, wherein the doctor inserts a tube into the pleural space to help release additional air. The tube may be left in place for several days once the air has been drained to help reinflate the lung. If the gunshot leaves a big enough hole, it will require surgery. Surgeons can access and visualize the injury in the lung via bronchoscopes placed down the throat into the bronchial airways. This visualization will help to determine the exact location of the injury and will allow optimal placement of surgical incisions. 5% of patients with a pneumothorax will also experience a hemothorax at the same time, which occurs when blood enters the same space. This can be treated with a tube in much the same way as a pneumothorax. Those suffering with this may require blood transfusions if a large amount of blood has also been lost. Both of these conditions must be treated as soon as possible, lest the patient die from inadequate respiration. Fortunately, if treated quickly and no other complications occur, a punctured lung is a survivable injury. But wait a minute. If what Biden said were true, there shouldn't be anything left to access or repair.
So the statement that this is going to blow the lungs out of the body is It's an untrue statement.
Indeed, the exit wounds caused by the Full Metal Jacket 9mm round appear to be only slightly larger than their entry wound counterpart, as if, true to their design, the projectiles did not expand very much.
It's going to be your Full Metal Jacket. Nice pointed tip and not a whole lot of energy transfer as it goes through.
Professor Garand expertly avoided other vital structures around the lung. The subclavian artery, which runs through the shoulder and feeds the brachial artery, which is the main artery of the arm, as well as the brachial plexus, the large nerve bundle that controls the arm, both above. And of course, the heart and right and left branches of the pulmonary artery towards the center line. Given the injury sustained, if this ballistics dummy arrives at the hospital alive, there is a good chance of survival.
9mm isn't a powerful caliber compared to a lot of the things that are out there.
Even the exit wound through the scapula looks fairly tame. It looks like the bullet punched a clean hole, causing a fracture isolated in the center of the bone, leaving the bone around it intact. Many fractures of the scapula can be treated non-operatively by immobilizing the shoulder and managing the pain. If, upon closer inspection via radiograph and other scans, the fracture pattern is more severe, we can use plates and screws to repair the damage. Obviously, our study is not exhaustive, but the information presented seems to refute Biden's statement. Let's up the ante and take a look at the hollow point variation. These rounds are designed to cause more destruction inside the human body. So, maybe they're the ones he was referring to.
Your hollow point is designed to expand when it hits that soft tissue. And this is a shot 147 grain.
As a hollow point bullet expands, the higher surface area equates to more energy transfer to the target, giving it more stopping power. This creates more pronounced wound channels, both permanent and temporary cavities, and slows the bullet considerably so that it is less likely to exit the target. And let's not forget about the sharp metal edges that reveal themselves as the bullet deforms, perfect for ripping and tearing soft tissue.
But you can see quite a significant increase in surface area.
Let's circle back for a moment to the fruit analogy from earlier on.
If I gave you the same grapefruit and a hammer, the flat striking surface of the hammer is going to transfer all the energy into the fruit, not go through and strike you in the hand.
When compared to Full Metal Jacket rounds, the hollow point ammunition is generally accepted as the more viable self-defense option, transferring more energy into targets, stopping them more effectively, and creating more devastating wound tracks, while still less likely to overpenetrate. However, that doesn't mean that the hollow point round will explode any tissue that it strikes. Soft tissue is, well, soft. In the next example, Scott from Kentucky Ballistics fires 2 rounds from his Glock 19 to show us how hollow point ammunition performs in ballistics gel.
So here's your real quick look at the wound channel of the 9mm.
The first shot slows considerably and actually tumbles left, exiting near the end of the first block, while the second penetrates into the second block. A very rough side-by-side comparison to our earlier Full Metal Jacket test by tools and targets demonstrates a spectrum of ammunition pattern response in soft tissues. A hollow point projectile is more likely to deform and slow, but results may vary from shot to shot. At the end of the day, a hollow point 9mm round is a bullet, and when a bullet strikes soft tissue, it can penetrate to varying degrees. With this in mind, let's take a closer look at the anatomy of the lung to determine how resistant they actually are to penetration.
And the first thing that tells you that this is lung tissue is that it looks like an expanded net of tissue over empty space.
Thank you, Ken Hub, for the excellent visuals. That's because the lungs are essentially a combination of tubes, bronchioles, and tiny air sacs, alveoli, suspended on a framework of elastic fibers that contain blood cells. Hence the red walls and empty spaces between. This makes them soft and spongy in appearance and relatively light despite their size. Can you imagine shooting a memory foam pillow with a 9mm? Regardless of the ammo type you use, the bullet is likely going to penetrate all the way through the pillow. I'm exaggerating here. Obviously, there is more to lung tissue than memory foam, but the analogy is informative.
You don't say!
Lung tissue is contained in 5 lobes, 3 on the right and 2 on the left, and surrounded by a membrane called pleura, which separates the lungs from the chest wall.
This is the visceral pleural membrane. Consists of mesothelial cells, elastic tissue, and a sparse fibrocollagenous substrate.
The role of this membrane is to minimize friction between the chest wall and lung tissue, not provide any meaningful protection from gunshot wounds or other puncturing trauma. That's what the ribs are for. But enough talk. Professor Garand, can you give us a closer approximation of how hollow point 9mm ammunition performs in the human body?
We're gonna use a hollow point round, a Norma. This is going to be defensive ammunition. It's MHP. It's a very common, very well-performing defensive round.
And then the question on all of our minds, will it blow the lung out of the body?
No.
It's very odd.
Very odd indeed. It's really not even close. And further inspection will only confirm what we already can see. The lung is still intact.
You can see that it has a larger entrance compared to your typical FMJs. That's because a hollow point will open up to ensure it doesn't have overpenetration.
As expected so far. What about the back of the dummy, Professor?
At the rear, you can see it did exit after expanding. However, the lung is, of course, completely intact.
Again, despite the hollow point tendency to open up, a well-aimed shot to the lung that is not deflected by one of the ribs and is not met with much resistance may come out the other side.
The 22 went in and out of the lung, and the 9mm went in and out of the lung. One of these is still in the body. Which wound is harder to treat?
Great question, Micah. Let me answer that for you. Generally speaking, when it comes to gunshot wounds, where you get shot matters much more than whether the bullet stays inside or exit the body. I have heard the assumption that a bullet that exits the body is less dangerous. But there are so many variables involved that a single sweeping statement doesn't really serve us. A shotgun slug that passes through the abdomen is going to cause way more damage than a .22 caliber round that gets lodged in the thigh. A .22 that passes through the neck and severs the carotid artery is a bigger problem than a leg that is riddled with buckshot. These examples are extreme, but you get what I'm saying. The data available on the subject is a tad confusing, since pass-throughs are more likely to occur in non-life-threatening locations such as the extremities, and it is easier for a projectile to become lodged in a thicker, more complex part of our body, like the torso. Due to the dangers involved in surgically extracting retained bullet fragments, doctors may opt to leave them in place if the patient is stable. If bullet fragments are left in place, we must consider the potential risk of lead toxicity as the bullet leaches chemicals into the body. And the CDC warns symptoms may only manifest years after suffering a gunshot wound. When the alternative is a complicated and risky extraction surgery, it may be worth betting on lead and monitoring the fragments and associated effects over time. Though extremely rare, there have been cases in which patients sustaining gunshot wounds to the chest managed non-operatively eventually expectorated the bullet. You know, just casually coughed it up. But less than 10 such cases were published over the past century. So don't hold your breath. Whether or not a bullet is left in place also depends on where it is and how difficult the extraction surgery will be. Let's circle back to our initial question about the lung.
Which wound is harder to treat?
Even in this case, it depends. How much damage did the exiting bullet cause? Where is the non-exiting bullet lodged? Earlier on, I mentioned some effects and treatments of penetrating lung trauma, but it can get worse. A penetrating lung injury wherein bronchi and blood vessels have undergone severe damage may require a tractotomy, which entails opening the tract of the lung injury so that bleeding points may be ligated and the bleeding stop. The lung is then sewn or stapled back together. Worst still, if the lung has been damaged beyond repair, a lung resection or removal of a part of the lung may be necessary. Both exiting and non-exiting bullets could necessitate either of these procedures. Furthermore, a bullet that is lodged in the lung too close to the pulmonary artery or vein could disrupt their ability to circulate blood and consequently impair the function of the heart. While a bullet lodged towards the periphery of the lung in a patient that has been stabilized successfully with thoracostomy tubes may not require surgery if no further signs of complications are present. The verdict? We need more information. And Charlie's words are strangely prophetic.
Actually,
The hardest one to treat would be determined by the hospital.
But wait, shouldn't the lung be outside of the body by now?
So begging the question, the 9mm did not blow the lung out of the body, but what caliber could blow the lung out of the body?
Now, we all know Garand Thumb wouldn't be Garand Thumb if we didn't subject our ballistics volunteer to rigorous scientific inquiry.
Next up, we have the AR-15, your typical 55 grain, again, from Norma Ammunition.
Yes, you heard me right. Everything you're about to see is done in the name of modern medical science. And rest assured, all of the aforementioned risks of penetrating chest trauma are multiplied as the ammunition becomes higher in caliber. Wait, didn't Biden suggest?
So the idea of these high caliber weapons, there's simply no rational basis for it.
I will leave the technical debate about what constitutes a high caliber projectile for firearms enthusiasts more educated on the subject than myself.
So you're a gun nut?
No, I'm a gun enthusiast.
Do you know how many people
Second
are
Amendment
killed each year in accidental?
All right.
But from my vantage point, there is a difference between this from earlier and this. Pretty intense stuff. Generally, as a projectile's diameter, length, and weight increases, and the firearm from which it is shot becomes more powerful, the damage inflicted increases. Now, we're definitely closer to separating the lung from the body. From the slow motion camera, we can see frightening temporary cavitation, a large exit wound, airborne blood, and shattered bone. The lung is still technically still inside the body, but its function will definitely be impaired. A shot of this magnitude will require surgical intervention and could easily be fatal. Professor Garand, can you take us in for a closer look?
The lung still seems to be there very conspicuously, despite hitting at a very similar location to the first round.
No matter how many times I see something like this, I am always struck by the size difference of entry and exit wounds.
Now, if we take a look at the exit, that simply added to the 223, but we have very good performance from the 308.
A bullet enters the body through a very small hole right at the point of impact. Once inside the body, the bullet begins to transfer its energy to the surrounding tissue. And as we have already mentioned, this transfer is more pronounced if the bullet deforms to create more surface area. I love this answer from DJC6535 on the Explain It Like I'm 5 Reddit page. Your muscle, bone, fat, etc. are slowing down the bullet by compressing and squishing together. But your body isn't 100% compressible. In fact, since it is made of water, it doesn't compress very well at all. As a result, your tissue starts moving due to the force of the bullet, traveling through the body. It hits more tissue, which in turn hits more tissue, creating an ever-expanding bulge of moving tissue. Sure, the more tissue that gets involved, the slower it goes. But that just slows things down from 900 plus miles per hour to 700 plus miles per hour. So while one small bullet goes in, a fist-sized chunk of tissue is moving at hundreds of miles per hour by the time it exits. But with the lung still intact, we'll have to continue with our research.
Holy.
Looks like they're still in there. Maybe a slug?
Okay, well, a lot of hunters hunt with slugs. Everyone has a slug, so we'll give it a shot.
Clear to fire, Professor.
Oh no, that just sliced him in half. Oh, it's on your glasses.
This is interesting. You know, I'm beginning to think that perhaps the term blow the lung out of the body is an inaccurate way to describe what occurs, even when a truly high caliber projectile makes contact with the body. The lungs are very much attached to the body. In fact, the pleural membranes that surround each lung are attached to the wall of the thoracic cavity by connective tissue to the inner surface of the chest.
Yeah, so it actually almost sawed him in half, and that didn't blow the lung out the body, it just annihilated the lungs completely.
Depending on the size of the projectile, it may take many shots before the lung is blown out of the body. And even then, your body might be severed in half before this occurs. Now, with all of this in mind, why did Biden say what he said? In his video on the topic, Colion Noir asked some other interesting questions.
If the 9mm is such an evil round and no one should be using it, why is the U.S. Secret Service switching from 357 SIG to 9mm? Why does the 9mm reign supreme as the standard duty caliber in issue across the U.S. within police officers? Why did the FBI in 2018 go back to using 9mm handguns?
Maybe you can help answer these questions in the comment section below. And hopefully today's video sheds some light on the president's recent statements. Now, I'm not looking to make this video a political statement, and as a physician, I am acutely aware of the problems associated with gun violence. However, I am a responsible gun owner, and if we are going to address this problem as a society, we must do it from a position of truth, and our actions should be guided by the facts. And if you're looking to make yourself a better version of yourself, then don't forget to join me at my online gym, Human 2.0 Fitness, right here on YouTube, where injury prevention and moving optimally reign supreme. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one.